Hi everyone, my name is Bryanna and I'm the manager of social media here at BioPro Armour, and I'm back with Dr. Warren today for our Ask the Vet series, where we discuss different horse-related health topics, as well as other relevant things happening in the horse industry. And I figured that today we would talk about colic because it's such a common health problem for horses, and there's always new things we can learn about it. How are you doing today, Dr. Warren?
I'm happy, Bryanna. How about yourself?
I'm doing well, keeping busy.
Well, good. So we're going to talk about colic today.
Yep.
Well, colic is a very serious and important problem in horses, as you know.
Yep.
And there's many, many causes. And the first we'll start with is the teeth. Horses that have malformed teeth, or you get little hooks on the outside and on the inside of each tooth, the way they grind their food normally, because the teeth is growing all the time. And these hooks have to be taken off, and we call it floating, to smooth out the mouth so they can eat properly without biting their gums or their cheeks and causing problems that way. So if a horse doesn't masticate properly and chew everything properly, there's a good chance that those things that are not, because of simple stomach animal, those things that are not masticated properly will ferment and cause problems in the stomach. So as you go down the alimentary canal, stomach is the first thing we come to, and with the presence of ulcers, of course, you have a problem sometimes if you have ulcers in a horse. There's a underlying bacterial infection going on in the stomach. And if food ferments, lays in there and ferments excessively, you'll get gas in the stomach, and you get a little gastritis from the ulcer, and lo and behold, the horse has got like a bloated stomach. The gas forms in the stomach, and it causes pain because it stretches the stomach lining. And usually that's pretty well taken care of by, usually we'll intube the horse and put some mineral oil down there, a little water maybe, mixture, and to help just coat that stomach and help the food to pass through. Now, farther on down, you've got the small intestine and the large intestine, and that's a whole other problem. Probably the most common cause of colic, you have a gas colic or you have an impaction colic. They start as gas, sometimes from, like we're talking about, too much fermentation too quick, depending on, maybe they got a hold of some bad hay or some sweet feed that was fermented or rancid, or oils that have been rancid. So to cause an upset in the stomach lining, and this fermentation process goes on because excess gas in the stomach and the intestinal lining. And of course, when that happens, as the intestine stretches, it produces pain. And usually on these gas colics, we can walk them out of it. Usually walking them a half hour to an hour, they can walk out of it. If they get too serious, if you can't control the pain, we control the pain with various things, of course. Veterinarians will have to do that for you. And everybody has their own little cocktail they use sometimes. So, but usually if walking horse won't, same with the stomach. If walking for 25, 30 minutes to an hour won't solve the problem. In other words, move the digestive material down the path and break up that gas, then the veterinarian needs to be called in and more serious things have to happen. And here again, we'll intube them with various things. Now, on the other hand, if there's no gas and everything stops and you have an impaction, that food will back up and pack in there, and it gets very hard and tight. And without the water, here again, watering horses is very important, and they have to have their amount of water in order to have that GI tract work properly, just like we do. If we become dehydrated, it becomes a problem. And a lot of these impacted colics are because the horses get dehydrated. They may come back off a long ride and not drink the water they should be drinking, and then they get fed too quickly, maybe before they're cooled out completely, and they'll get impacted, and this can be serious. Now, here again, we use the administers the mineral in the tube down their nose and walk them. I mean, I've walked horses for 3 or 4 hours, keeping the under control, the pain under control with various medications. And that's the secret in having a successful colic outcome, is keeping the pain under control. If you can't control the pain for more than an hour, you best get that horse to a hospital where they can put in IV tube for electrolytes and supportive therapy fluids, so they can get completely hydrated again. And they need to do surgery, they're there ready to do surgery. At the racetrack, we see a lot of colics because of the anxiety and the stress of the animal coming off of work or a race, and or just being in a stall and getting upset for one reason or another. So there's a lot of different causes of colics.
Yeah.
A lot of them can be worked out by just walking them. If you can't control the pain or get rid of the symptoms by walking, you need to call a veterinarian ASAP and get some pain medication in. If they can't control the pain along with the walking, then you need to get to a hospital and have that horse operated on or looked after to where they can be operated on if they need to be. A lot of times they won't have to be. They get hydrated with the IVs, and at the racetrack, we would ship them out pretty readily because the track is no place to be hospitalizing the horse. With everything going on, there's a lot of activity. And we used to, hang a jug into them of fluids, and we'd give 15, 20 liters of fluid over a period of 24 hours. And still, the horse would have a problem. We didn't have to ship them out. So I got to the point where if I couldn't control the pain and get the colic under control by walking, within an hour and a half, they were on a van ready to go to the hospital. And there's a hospital close by the track that does nothing but colic surgery, so they could take care of them. A good percentage of them never have to have surgery. They just have to have that extra fluid going into them and oversight to make sure they can control the pain. So,
Yeah. Well, that makes a lot of sense. And I guess that was one of the questions I had, was like how often surgery has to be performed versus, just managing it without having to get there. So it's good to know that, surgery isn't needed very often. Um I haven't had a personal experience with a colic case, but like I've had like friends tell me about their experiences, and I've also seen a lot of people's like Facebook posts about how their horses have passed away from it. Um so I think it varies a lot on a case by case basis, but I think colic is a really good reminder of how sensitive horses are.
Of course, we just talked on a couple of kinds of colic. Now, the very serious kinds of colic, here again, if you have a case of colic
Mhm.
and you walk that horse for, let's say, an hour, half an hour, 45 minutes, and you have no response as far as the pain is concerned, the horse still wants to go down and roll, which we try not to let them do because you don't want to flip a
Yep.
gut. So if that happens, I call the vet in. You should call the veterinarian in immediately to do a rectal exam to find out exactly what's going on. That way they can pick up whether it's a gas colic, a impaction in a lot of cases, or more importantly, if it's a twisted intestine or an intestine that has worked its way through one of these foramen in the mesentery or the splenic ligament to where that gut gets trapped and then is uh, not able to move the food collection. It causes pain because the intestine is not in a normal position. It's trapped in that loop of mesentery or the splenic ligament. In those cases, they usually have to have surgery in order to solve. You can't. Very often you can maybe reduce it, but in those cases, generally they do the surgery to prevent any problems. Once it goes to a certain point, it becomes irreversible, and it's hard to reverse. So you don't want to let that horse get toxic
That
before
makes
you do the
sense.
surgery in order to have a complete successful surgery.
Mhm. I remember reading a long time ago that like some cases of impaction can be so bad that it like restricts the blood flow to a part or a fairly large part of the intestine depending on where, and then the intestine can actually start to die because of the blockage. So
Well, that's true, and
very
a lot of
sad.
times, sometimes that piece of gut that you're talking about that has the circulatory system compromised is due to worms. The ascarids will,
Mm,
as the larvae migrate, they'll migrate down some of those arteries and veins that service the pieces of intestine, and if they become blocked and the intestine doesn't get its proper circulation, it'll start to die, and then you'll get a colic as well as a septicemia. But and those are, of course, have to have surgery done as well because you have to take that piece of gut out that's dead, you
mhm.
know, and an anastomosis. So surgery it's so technical now and so advanced that it's very successful, generally speaking. If the horse has not got septic problems, then the surgery can be very successful. And here again, as far as your healing process goes, even after surgery,
Mhm.
that's where your BioPro Armour comes in because it'll help to increase the immune system to help the healing process of that intestinal tract. So it all ties together in
Yep.
uh, in a nice, neat bundle. But it is a serious problem, and the smart horseman that can pick it up early, the earlier you pick it up, a lot of horses, if they'll lie down. One thing about a horse with the stomach problem, when they have gastritis and have a stomach gas in the stomach where it really causes pain, these horses will show you that because they'll sit like a dog.
Yep.
They'll sit in their stall like a dog on their hind legs. They just sit like a dog with their front legs stretched out, and those are pretty common to see as well. So, but by far the most important, the most common colics are impaction colics and gas colics. Those are the two that we see the most of.
Yep. And I think that colic is also a good reminder of the importance of proper horse dental care and making sure that
Mm.
like the feed is also appropriate for the horse because some horses eat really fast and that can put them at higher risk for things like that, especially because horses don't have the ability to vomit as we do. So if they eat too fast, then that can um put them at risk for choking and other things if it you know if the food does make it down their esophagus and they don't choke.
That's absolutely true. The other thing about it is that you have to monitor your feed as well.
Mhm.
Feed, sweet feed left out in the sun, for example, that has or any oily feed with oil in it. If that becomes rancid, that becomes another problem with the GI tract because those any kind of problems with the quality of feed will increase the problems with colic as well. So you have to make sure that your feed is always fresh. And I don't like to have any feed or vitamins sitting out in the sun because all it does is ruin the nutritional value and can cause other problems that may come along.
That makes a lot of sense too. Like I feel like not storing feed in the sun is like common knowledge, but we all forget as people and it's important to remember not to do that.
Well, here, the other problem is that sometimes feed and vitamins are delivered to your barn, and that drum is sitting out there, and you may miss it, and you won't get there to the next day, and that thing is sitting out in the sun all day till you get there the next day
Oh,
uh,
yep.
or that evening. Put it in.
It's
So those are kind of things that they're little things, but they're pretty very important when you come right down to it.
yep. All the little things add up
Yep,
and can create bigger things. And then we
absolutely.
also have the reminder of how the immune system is so, so important uh, in horses as well as in humans.
Well, here again, as you realize, 70 or 80% of the immune system is located within the GI tract, within the intestinal tract.
Hmm.
So the biome in in the small intestine, large intestine, uh, if it gets to be immune deficient, all these things are easier to have happen. In other words, the gut lining is uh, compromised, and you don't get the right absorption and the right motility of that gut moving the food down the chain. So it's all tied together, and a lot of times we don't realize that the immune system is so active in the intestinal tract. We just think about the other parts of the body, like the lungs and heart and so on and so forth. But the immune system is dependent on a strong, I mean, the intestinal tract is dependent upon a strong immune system to operate properly.
That I do remember learning about some of that on my own. And I think it's a really important thing to remember as well. Um, as far as treatment goes, is there anything else that we haven't covered that could also be a colic treatment, or is it mainly just the surgery and the walking and
Oh,
things like
there's for impactions, we'll use a product called DSS, which helps
that?
to soften and it's mineral oil. together, which helped to soften that GI tract. Now, it's also in these later days, mineral oil has been a plus or a minus, because if a horse looks like he's going to have surgery, they just as soon not use the mineral oil in there, because that kind of messes up the surgical thing when you got mineral oil running through the intestinal tract. So
Yep, they have to be clear for that.
yeah, so there are some iffy things that we used to do routinely before the surgeons got so efficient in doing their job, that the IV fluids are probably one of the most important things you can do to start with. If you can't send them to the hospital, the vet will usually start them on some IV fluids in your barn, just to try to get them completely hydrated, which will, a lot of times, along with the pain medicine they use, will help to solve the problem, but along with the walking. So those are the real conservative ways of doing it. That way, that's one reason why, of course, at the racetrack, we have so many other things to do that we can't. It's hard to treat a horse like you would in the hospital, where you're sitting there 24 hours with him. Although I've done that. So it gets to the point where you need to send them to a hospital where they can be monitored properly, and have surgery as soon as possible. Because the sooner you have surgery, the better the outlook, as far as if you have to have surgery. You wait too long, then you have the problem of sepsis and maybe even getting some laminitis as a result. And then you have a horse that's foundered, which is another complication altogether, which you don't want to see.
Yep. And just another reminder of how one thing can lead to another.
Yeah, these horses are so big and so powerful and so beautiful. We don't realize how tender and critical some
Exactly.
of these things can be to them.
Exactly. And I feel like that was a point that I wanted to bring up too, is we don't realize how many things can go wrong with a horse until you really start to delve into it. So that's why I really like doing these videos, because we can cover all kinds of things. And I feel like this is a good place to end off for the colic episode, but um you did bring up some interesting points about ulcers, so maybe we can talk about ulcers next time, because those are also very common for horses as well.
Yeah, they're
Um
very common.
yes. And I've heard of many uh cases at the barns I ride at, and how the staff there go about trying to help the horses before veterinarians get involved. So that's definitely a good topic for next time.
Sounds good.
Well, I appreciate your time today, Dr. Warren. It's lovely talking to you as always.
Well, it's nice talking to you, Bryanna. And if anybody has any questions, I hope they get a hold of you and we can talk them over. And because everybody has different questions and
Yes,
specific to their own horse. Every horse is a little different.
of course. I've been posting every Saturday, asking for questions, and we haven't had much engagement yet, but we'll just keep going, and
All you can do is
hopefully
keep
more
trying.
people will start to reach out. Yep.
It's like a horse, you start training them early on. You got to go this, this, and this. You go one step after another. And that's what we're doing.
Yep, of course. Well, that'll be it for today's episode. Thank you so much, everyone, for watching. You can follow us on social media, Facebook, Instagram, and TikTok at BioPro Armour. Um, as I say at the end of every episode, our goal is to eventually do these live. And I usually post the Ask the Vet post on Saturdays, either a video or a text post, and you can Post your questions in the comments of any of those posts, and we'll be happy to answer them in a future video. And I hope everyone has a good morning, afternoon, or night, wherever you are.
Thank you much, Bryanna. Have a great day yourself.
Thank you, Dr. Warren. See you next time.
See you next time. Bye-bye.
Bye.